talking about increasing access to tobacco cessation through referring patients that are interested in quitting to the Texas Quitline. So I'll first walk through several tobacco-related definitions and data, and I'll also go into the why. Why is this so important to be talking about, and why are we addressing it? And then I'll discuss the resources and benefits of the Texas Quitline, and then move to talking about the Ask Advise Refer workflow, and then we'll move on to talking about the e-tobacco protocol as well as the Texas Quitline app. So during my presentation, when I refer to tobacco products, I'm referring to all forms of tobacco. So this includes cigarettes and hookah, electronic cigarettes, cigars, cigarillos, chew and spit tobacco, snus, and other dissolvable products. And although the research on electronic cigarettes is still evolving, it's really important for health professionals to look at this issue comprehensively. Tobacco use can cause oral cancer and gum disease, as well as other oral health problems. Can also increase the risk of periodontitis, periimplantitis, caries, dry socket, and halitosis. And smokeless tobacco specifically increases users' risk of oral cancer and can cause oral leukoplakia, which can lead to cancer. And studies have shown that vaping may contribute to gum disease and more cavities, possibly due to the added acidity. And a study showed that the oral microbiome of e-cigarette users without gum disease looked like the microbiome of people with periodontitis. And periodontal disease is normally seen more in adults, but is now being seen in younger people, which is being tied to vaping. And then looking at the bigger picture, studies link gum disease with a higher rate of strokes and higher blood pressure. And here are the data from the Behavioral Risk Factor Surveillance System. So looking at adult tobacco use in Texas, we can see that the smoking prevalence decreased from 2017 to 2021. And if we look at the Texas vaping prevalence among adults, you can see from 2017 to 2021, there has been a slight increase. And these data are from the National Youth Tobacco Survey. And according to the data from the 2023 survey, there are about 2.8 million youth who are currently using any form of tobacco. And this is actually an overall drop from last year. Among high school students, we saw a decrease in any tobacco use between 2022 and 2023. And this can be attributed to a drop in the e-cigarette use among high school students. And unfortunately, we did see an increase in any tobacco use between 2022 and 2023 among middle school students. And 10% of students reported that they currently use any tobacco product. And for the 10th year in a row, e-cigarettes were the most popular product. On a positive note, cigarette and cigar use remain at an all-time low. The following data are from the Texas Youth Tobacco Survey. And so when we look at the past 30-day use of any tobacco product use among Texas youth, you can see that both high school and middle school students' use rates have dropped over the years. And that's also true for the past 30-day use for e-cigarettes. And this is important because in addition to other health concerns, youth who use multiple tobacco products are at a higher risk for developing nicotine dependence, and they might be more likely to continue using tobacco into adulthood, which obviously has lifelong impacts. Untreated tooth decay is higher in people who smoke cigarettes, and among adults between the ages of 20 and 64, over 40% who currently smoke cigarettes had untreated tooth decay. And the percentage of adults between 20 and 64 with untreated tooth decay between 1999 and 2004, and also 2011 and between 2011 and 2016, increased from 39% to 44% among current smokers. And it also increased from 20% to 25% among former smokers. And it remained the same among those who, at 20% among those who had never smoked. Older adults who smoke cigarettes are twice as likely to have untreated tooth decay as those who never smoked. And about 1 in 3 adults between age 65 or older who smoke cigarettes have untreated tooth decay. And people who smoke are 3 times more likely to lose all of their teeth. And looking at the percentage of adults between or who are at least 65 or older who lost all of their teeth between 2011 and 2016, 43% were smokers. Now we know that cigarettes have over 7,000 chemicals, and we know that 69 of them are known to cause cancer. And cigarette smoking alone kills 28,000 people each year, just in Texas, and it kills 480,000 people every year across the entire United States. This includes 40,000 deaths from secondhand smoke exposure. Tobacco use costs the state of Texas more than $34 billion in healthcare expenditures and lost productivity. And tobacco use is the leading cause of preventable death and disability. It causes cancer, heart disease, stroke, diabetes, and lung disease. Looking at the benefits of smoking cessation over time, you can see the improvements that can be made in just 20 minutes, where smokers can start to see their blood pressure and heart rate drop. And within just a few days, the carbon monoxide level in the blood drops to normal. After 2 weeks to 3 months, the blood flow improves and lung function increases. After 1 to 2 years, the risk of a heart attack drops dramatically. After 5 to 10 years, the risk of cancers of the mouth, throat, and larynx are cut in half, and the risk of stroke decreases. After 10 to 15 years, the risk of heart disease is decreased to half that of current smokers. And after 15 years of cessation, the risk of coronary heart disease is close to that of a non-smoker. Here I'll go over some highlights from the Clinical Practice Guideline Treating Tobacco Use and Dependence 2008 update. I also have a link at the end in case you'd like to read further into this. So of course, we know that tobacco dependence is a chronic disease. So it's really important to remember that oftentimes tobacco cessation may require repeated intervention and quit attempts. And so that's why it's so important to ask patients about their tobacco use at each visit. Another important component is documenting every patient's tobacco use status to help them receive the best care and treatment. And these highlights also note that individual group and telephone counseling are effective means of cessation, and that while cessation and medication are effective when used alone for treating tobacco dependence, when they're combined, they are more effective and they give patients the best chance of quitting and staying quit. And finally, telephone counseling is effective with diverse populations and has a broad reach, which is really important, particularly considering the diverse individuals that you're working with. According to the 2020 Surgeon General's report, among current adult smokers, nearly 70% want to quit, and over 50% of adults who smoke will try to quit each year. And 3 in 5 adults who ever smoked cigarettes have quit already. And when healthcare providers are actively intervening to connect their patients with cessation resources, the patients are 66% more likely to be successful in quitting tobacco. And brief cessation interventions are not only clinically effective, but they're also cost effective. And we also know that some form of behavioral counseling, when combined with cessation medication, can double a patient's chances of quitting and staying quit when compared to someone who's trying to quit with self-help or no treatment at all. In fact, fewer than 5% of people who quit without assistance are successful in quitting for more than a year. So now I'm going to talk about the resources that are available through the Texas Quitline. The Texas Quitline services are free and they're available through Texas Department of State Health Services funding. They are available in both English and Spanish, as well as additional languages through simultaneous interpretation. So it's really accessible, and the calls are answered and counseling is available 24/7. So it's super convenient. And then of course the service is private and confidential and HIPAA compliant. The Quitline offers some really great benefits, including 5 counseling sessions for patients who are at least 13. And then patients who are at least 18 can also qualify for 8 weeks of free combination nicotine replacement therapy. This has increased from a couple months ago when it was just 2 weeks. So now it's 8 weeks. And this includes gum, patches, and lozenges. And they're mailed to the patient's home, which is really nice and convenient. And referrals from providers can be made at any time, and patients can enroll up to 2 times per year. There are a few requirements that the Quitline has. Patients being referred to the Texas Quitline must have a Texas address so that the Quitline can mail the nicotine replacement therapy. And then they also need to have a working US phone number so that the Quitline can reach out and schedule those counseling sessions. And then, as I mentioned, to receive the counseling, they need to be at least 13 and at least 18 to receive the nicotine replacement therapy. And then they also need to be ready to quit within the next 30 days, which I'll talk about in a little bit more detail shortly. It'll be important for the patients to make sure they answer when the Quitline calls, as it may come up as an unknown number. So just reminding them to make sure they answer any calls coming in over the 48 hours following the receipt of the referral. And it's really nice because the Quitline will proactively call the patient. So once they agree that they're interested in tobacco cessation, you don't have to hand them a card and hope that they're actually going to call and follow up. The Quitline will do all that work. So once a referral is made by a healthcare professional, the Quitline receives the referral and the patient will receive a call within the next 48 hours. And they'll make up to 5 attempts to reach the patient. So that gives the patient a little bit of flexibility in case they miss the first call or so. And then once the Quitline reaches the patient, they'll ask a few questions, help tailor the service for the patient. And they'll set up that first counseling session with their quit coach. And the quit coaches are extensively trained and will connect with the patient on up to 5 counseling sessions. And then the patient will receive their nicotine replacement therapy within that time period also. And then on the provider side, the Quitline will keep the provider updated in what they call events. So if the patient enrolled in the program, once they're reached, once they complete their first counseling session, if the nicotine replacement therapy are ordered, and if the referral is closed without enrollment, those types of things will be can come back as progress notes into the electronic medical record if healthcare system is using direct trust messaging, which is a transmission method through the electronic medical record, or it could come through as a secure fax, whichever you decide is best. The stages of change model can be used to think in terms of a patient trying to quit using tobacco, starting in the pre-contemplation stage. At this point, they don't see tobacco as a big problem impacting their life. And then later they may move into the contemplation stage where they're open to receiving information, recognizing that tobacco is negatively affecting their life. And this is the best stage for a patient to be in, to really be open to listening and considering enrolling in the Quitline. This is where they are likely to reach the I'm ready to quit within the next 30 days point. And from there, they'll move into the preparation stage where they're really planning to make the change, such as quitting, making decisions on how to move forward and start gathering resources. Then they'll move into the action stage, which is when the behavior change takes place. And then they'll move into the maintenance stage, and the patient can begin using the resources and support that they've put into place during the preparation stage, such as the counseling or the nicotine replacement therapy. And they may continue on in the maintenance stage, or they may go into the relapse stage. And it's really important that they are reminded that this is an addiction and it's quite normal to relapse, especially someone attempting to quit for the first time. It can be really discouraging to have this setback, but it takes an average of 7 to 11 times. So that's really important to remember for someone to quit and stay quit. So if they do relapse, they can jump right back on and try again. The Ask, Advise, Refer workflow is an evidence-based approach to tobacco cessation. It's a pretty quick process. It usually only takes between 3 and 5 minutes. So as tobacco dependence is a chronic disease, patients need multiple opportunities to quit, which makes it really critical to consistently be assessing tobacco use and making cessation opportunities available in clinical settings. All patients who are at least 13 years old should be screened for tobacco use, and this information should be documented in the health record. It's also really important to make sure you're asking about all forms of tobacco, including vaping products. And just noting that the ask doesn't have to be done by a doctor. This role can be any member of the care team, including a hygienist. And then if a patient is identified as a tobacco user, that's what triggers the clinical tobacco treatment workflow and moving on to the advise stage. So during the advise stage, this is the opportunity to talk with the patient about quitting. And during this step, you assess their readiness and motivation to quit, assess any perceived barriers they may have, and inform the patient that there are resources to help them quit if they're interested, including the Quitline and any other local resources that you know of that may be available for them. So when coming up with the appropriate advice, be sure that your message is clear, strong, and personalized to the patient. Clear messages might sound like occasional smoking is still dangerous and harmful for your health. An example of strong messages are, as your healthcare provider, I need you to know that quitting tobacco or vaping is the most important thing you can do to protect your health now and in the future, and we're here to help you. Personalized messages help connecting the patient's current symptoms and health concerns, their social and economic costs, and or the impact of tobacco use on their family or children. So for example, saying something like continuing to use tobacco or vaping makes your asthma worse, and quitting may dramatically improve your health. It's also important to understand and prepare patients for potential barriers. And nicotine withdrawal can really deter people, especially if they're unprepared. Oops. There may be cravings, so be sure that patients have a quit plan. They should plan ahead as to how they're going to manage these cravings when they come up. They can use distractions. It'll be important for them to stay busy and think about their why and their quitting reasons. And they should also know what their triggers are and try to avoid them, at least temporarily. They may have irritability, and this will diminish if they stick with it. It usually peaks after 1 week and may last between 2 and 4 weeks. They may have difficulty sleeping. Oops. So they should make sure that they limit screen time, including keeping TV and phone off, stick with a bedtime routine, limit their caffeine, alcohol, and any big meals before bedtime. They may also experience difficulty concentrating, and this will also diminish if they stick with it. They may also experience restlessness, so encouraging them to add in some physical activity, which could be as simple as a walk or yard work or chores, and limiting caffeine can also help with that. They may have sadness, anxiousness, or depression. And nicotine and mood are connected, and nicotine affects the brain. And using tobacco is actually what's relieving the nicotine withdrawal symptoms, such as anxiety. But it is temporary, and cessation counseling can be really, really helpful in getting through these feelings. It's also really important for individuals to seek guidance from their mental health provider. And they may also feel hungrier than normal, so encourage them to keep healthy snacks close by, especially crunchy snacks can help manage that. And then during the refer step, this is when you will refer them to the Quitline if they're ready to quit within the next 30 days. Be sure to give them any written materials to give them the extra support. We have some really great resources on our website, and I have a link that I can share at the end. And as I mentioned earlier, healthcare systems can receive the patient progress notes back to know if the patient received counseling and nicotine replacement therapy. So here are some recommended questions to consider asking, and these might already be in your current workflow, but if not, it's something you can discuss with your team. It's important to cover all forms of tobacco, like I mentioned before. Clarify also that you want to talk about vaping and electronic cigarette use, since some may not think about this when they're being asked about tobacco use. So I'd strongly encourage just paying attention to the language being used. The term smoking won't be applicable to people using smokeless tobacco or vaping, for example, just like people who vape may not consider themselves to be tobacco users. So once you ask about tobacco and vaping use, if they respond yes, you can then prompt to see if they are current users. And a current user is defined as someone who's used in the last 30 days. And from there, it might be helpful to find out what types of products they've been using, and then you would advise them to quit. And then next, you would ask if they're interested in ready to quit in the next 30 days. And if they answer yes, you would just ask them if it's okay for the Texas Quitline to reach out to them, when the best contact time is, and if it's okay for the Quitline to send text messages. There are 3 ways for referring a patient. All 3 of these methods, the patients receive all the same resources from the Quitline. Referrals can be made through a paper-based fax referral, the e-tobacco protocol, which is done through your electronic medical record or electronic health record, or through the Texas Quitline app. And I'm mostly going to focus on the e-tobacco protocol and the Quitline app. The e-tobacco protocol is a seamless link between assessing for tobacco use, identifying patients ready to quit, and providing access to quit resources through your electronic health record. And our team is able to provide free technical support if this is something that you'd like to explore further. And we can provide training and continue to assist through implementation and ongoing support. There are many benefits to referring using the e-tobacco protocol, including that it's an efficient counseling and referral method, and the Quitline will proactively connect with patients interested in quitting. Another option is referral through the Texas Quitline app, which is available for free download on Apple and Android platforms. And patients receive the exact same benefits of counseling and nicotine replacement therapy as those referred through the e-tobacco protocol or fax. So it's a nice alternative if for some reason the e-tobacco protocol isn't an option. Of course, it's also HIPAA compliant. So I'm going to run through a brief rundown of the app. You'll see this is the provider profile you'll need to set up just the first time that you are setting up the app. And the profile will identify the person who's referring as well as the associated agency. So you'll enter your name. You can see in this example, I've entered my name and then follow with your email. Another important part of the profile is the question about whether you're a HIPAA covered entity. And I've answered no, as my employer is not, but many healthcare systems would likely have a different answer, of course. And the answer to this question does not change any of the services provided to the patient. It just lets the Quitline know if they can send protected health information back to the agency. Next, you'll enter your clinic or facility name, and it's really important for individuals within the same agency to use the same naming convention. So for example, if you are with ABC Hospital and there are multiple locations, your location may choose to list it as ABC Hospital-Springdale Clinic, and everyone else who's completing a provider profile who's also with ABC Hospital Springdale Clinic would use the same exact naming convention. This is important because the Quitline sends a monthly aggregate report that I can then share out with those that are referring. And if your clinic name differs at all, it just, they're not all the tallies are together. So it just makes it a little bit more complicated for you to see how many referrals came from your entity. The following are screenshots that provide an idea of how the app works, and this is from the Advise tab. And you can see on the top right-hand corner that the app is bilingual and can easily toggle between English and Spanish. And this section is really helpful as a prompt and a quick reminder on how to move through the Ask Advise Refer model, as each of the boxes expand to offer ideas of questions or statements to make during each component. Once a profile has been set up, a referral can be sent by entering the person's name, date of birth, and phone number. And you'll then click the boxes of the tobacco products that they use and check whether the person's ready to quit within the next 30 days. If the Quitline does not have permission to contact the patient, and then if nicotine replacement therapy is authorized if the patient is at least 18. So then you're able to select the language the patient prefers to speak in and the best time to call the patient so the Quitline can best prepare for calling them. And you can see the refer information at the end of the referral. In this example, it's my information. So if you need to make any edits to that, you can click the update profile. And then once you're ready, you can click submit, or you can submit by clicking refer the patient. And the Quitline will call them within 48 hours of receiving that. And then once you click that, you will not be able to see the referral details after you confirm that. So this is the referral information is not stored on your device, but it is kept. There is a record that's kept in the past referrals tab. So when you open the past referrals tab, you'll see the dates that you sent a referral. And when you click on the date, the screen to the right opens and you'll see the dates in time that you made the referral. And note that the only information about the person referred that's kept is the date of birth. And then the rest of the information is from the referring provider, which in this example is my information. When you click resources on the bottom menu of the app, the main content area pops open. In addition to the referral option, the Texas Quitline offers a full menu of other resources. And when you click on each item, the heading opens up to more information. So for example, there's tobacco basics, which breaks open a larger menu to give more information about youth, electronic cigarettes, tobacco marketing. And the tobacco and health also expands and provides specific talking points for referrers who are talking with community members about how tobacco impacts their specific health concerns. So just to summarize, document every patient's tobacco use status. Counseling and medication, when combined, give your patients the best chance of quitting and staying quit. And the Texas Quitline is free and offers 5 free counseling sessions and free nicotine replacement therapy. And then ask if the patient uses tobacco, advise the patient to quit, and refer the patient to the Quitline. And referrals can be made through fax, e-tobacco protocol, and through the Texas Quitline. Thank you so much. If you have any questions or if you're interested in integration within your electronic health record, please feel free to reach out to me and we can talk more about that.